You walk into the kitchen, open the fridge, and you just stop. You think, what was I looking for? If you've had that moment recently, don't dismiss it as just senior moments. Hi, I'm Ava Chen, and as a health coach specializing in senior vitality, I see these moments far too often, and I know they're a warning sign.
You are absolutely right, Ava. Groundbreaking research from the Mayo Clinic revealed that the brain begins to deteriorate a shocking 6 years before a formal dementia diagnosis. That slight memory lapse you just experienced, it might be your brain's very first cry for help.
The good news is, we have a golden time. Today, Dr. Sterling and I will share 5 simple, powerful methods, no prescriptions, no expensive supplements that you can start right now, with your own hands, to protect your brain and your family. Make sure you stay until the very end, because the single most important exercise is one you can do while brushing your teeth.
As a neurologist who spent 2 decades saving thousands of brains, I can tell you this. It was not just a slip of memory. Your brain is signaling that it's starving for oxygen and nutrients. Stay with us, because these next 20 minutes could change the next 10 years of your family's life.
Yes, Dr. Sterling. Why don't you start with the science, then we will talk about the 3-minute fix.
Sure, let me tell you about a patient I treated. Esther, a charming 73-year-old former art teacher. She came to me not because she forgot a name, but because she suddenly couldn't finish a complex quilt pattern she'd been working on for months. She explained, "Doctor, the colors are right, the fabric is right, but I simply can't remember the sequence of steps. I just stare at the pieces. It was as if my hands forgot how to talk to my brain." That confusion intensified. A week later, she put a pot on the stove and walked away, forgetting it completely. We did the MRI. Her hippocampus wasn't the size of a 73-year-old's, it was severely shrunken. She was in early cognitive impairment. I want you to know the 7 early warning signs. If 3 or more apply to you, your brain needs urgent help.
7 signs to watch for. 1. Episodic memory loss. Can't recall what you ate for lunch yesterday. 2. Executive dysfunction. Forgetting the sequence of steps in a familiar recipe. 3. Verbal repetition. Constantly repeating the same words or questions. 4. Spatial disorientation. Getting lost in a familiar neighborhood. 5. Calculative decline. Difficulty counting change or simple math. 6. Apathy, depression, losing interest in things you once loved. 7. Personality change, becoming unusually irritable or aggressive. If you check 3 or more boxes, this is your golden time.
Esther was not too late. Her focused 8-week program, which Ava will show you, specifically targeted her sequencing and spatial awareness. 3 months later, she sent me a photo of a beautiful, finished quilt. Her formerly atrophied hippocampus was regenerating. Brain blood flow increased by 23%, and her cognitive test scores jumped 40 points. I realized then what my mentor always said. The secret to preventing dementia isn't in a pill. It's in the habit of frequently waking the brain. We just need to give it a nudge.
And the good news is, the science backs this up. A study from the UCLA School of Medicine found that with just 3 minutes a day of simple, specific exercise, brain blood flow increased dramatically by 19% to 22%. This proves that waking up the brain is a real and powerful strategy.
This is the hope we want to share. Your brain is not asking for medication, it's asking for a simple routine. The important thing is recognizing the subtle signs. And we've already given you the 7. If you matched 3 or more of those 7 signals, the memory loss, the executive decline, the personality change, you need to start this routine today. This is your chance.
Before we reveal the 5 specific exercises Dr. Sterling gave Esther, let's understand the bigger picture. Why are our brains aging so fast? Dementia is no longer a disease only for the 70s and 80s. The brains of people in their 40s and 50s are quietly deteriorating right now. It's a shocking reality.
I recently treated Thomas, a 55-year-old small business owner. He was successful but visibly exhausted. He wasn't worried about names, he was worried about his temper. He came in and said, "My employees say I've become aggressive and forgetful. I snap at my wife. I'm not myself." I asked him about his life. "How often do you talk to friends?" "Not much, I'm too busy." "How are your meals?" "Quick drive-through lunches." "And stress?" "Non-stop." That's the key. His brain wasn't aging from a virus. It was aging from isolation, chronic stress, and inflammatory foods. His lifestyle was directly attacking the part of his brain responsible for emotional regulation and memory retrieval.
The Alzheimer's Association reports that 9% of all dementia cases are in people under 65. The cause is clear: chronic stress, sleep deprivation, processed foods, lack of exercise, and social isolation. Our modern life is an aggressive attack on the brain.
The Harvard Medical School revealed that just 10 minutes of light activity a day can slow brain atrophy by 25%. 10 minutes. The time it takes to have a cup of coffee or walk the stairs instead of taking the elevator. I always tell my patients, a tired brain, a starved brain, a lonely brain, that is where dementia truly begins. Now, let's talk about 5 silent habits, the silent killers that you might be doing every day that damage your brain. 1. Less than 6 hours of sleep. Did you know that when you sleep less than 6 hours, a toxic protein called beta amyloid builds up in your brain? This is the primary culprit behind Alzheimer's. Your brain cleans house while you sleep. If you skip sleep, your brain turns into a landfill. 2. Uncontrolled hypertension, diabetes, or high cholesterol. Even with medication, damage is done. High blood pressure cuts brain blood flow by 30%. Diabetes hardens brain vessels. High cholesterol blocks the pathway. Your brain uses 20% of your body's entire blood supply. If that path is blocked, your brain starves. 3. Processed foods and trans fats. Convenient food like frozen meals and snacks contain trans fats that stiffen blood vessels, reducing blood flow by over 30%. Your brain is running on half the oxygen it needs. 4. Sedentary lifestyle. Failing to meet the WHO's recommended 20 to 30 minutes of activity a day increases your dementia risk by 45%. Exercise is the most powerful pump for brain blood flow. It wakes up brain cells and grows new neural connections. A sedentary brain is like stagnant water, it slowly decays. 5. Loneliness. Chronic loneliness causes brain inflammation and increases the dementia risk by 1.5 times. A brain thrives on conversation, laughter, and connection. When you stop talking, laughing, and sharing, your brain starts to die. If you don't change these 5 things, no pill or supplement can save your brain. But the opposite is also true. Change these 5, and you can reverse brain aging.
This is the core of our approach. Let's show you how to change it. Starting with that incredible 3-minute fix that saved Esther. Remember Esther? We revived her brain in just 8 weeks. Using a 3-minute neurostimulation routine. Research proves this works. 3 minutes of neural stimulation increased brain blood flow by 22% and improved memory by 15%.
I personally compared the before and after MRIs of patients after just 8 weeks. The change was shocking. The foggy gray hippocampus brightened dramatically. This isn't just a research paper. I saw the change with my own eyes.
Here are the 5 simple, powerful exercises we taught Esther, focusing on the hippocampus, frontal lobe, and cerebellum. 1. The pa-ka-ra exercise, tongue and pronunciation. Say the sounds pa-ka-ra rapidly, like a machine gun. This motion activates over 30% of your brain. Do it often, not long. 3 sets of 10 times, 3 times a day. 2. Hand stimulation, the confusion fix. Clasp and unclasp your hands rapidly. Or try counting backward with your fingers. Moving your hands wakes up the brain's motor cortex. The more confused you get, the more your brain is building new connections. 3. Brisk walking, the blood pump. This is non-negotiable. Harvard found that 30 minutes of brisk walking for 6 months increased the hippocampus size by 2% and blood flow by 25%. Aim for about 18 steps every 10 seconds. This speed is the true age of your brain. Swing your arms wide, chest out. Every step pumps blood to your brain. 4. Neck and scalp massage. Blood vessels. Feeding your brain run right through your neck. Gently press and massage the back of your neck with 4 fingers. And lightly tap your whole scalp. This simple act can double the blood flow to your brain. 30 seconds, morning and night. 5. The one-leg stand. While brushing your teeth, stand on one foot for 10 seconds. While brushing your teeth or talking on the phone. This activates your cerebellum, balance, and frontal lobe, focus. If you wobble, that's great. Your brain is working. Just keep a wall or chair nearby for safety.
The brain does not lie. Give it the stimulus, and it will respond. Dementia is not an inevitable fate. The brain can grow and change even at 80, 90, or 100. As long as we don't give up, the brain won't give up on us.
Here are your 5 daily principles, starting today. 1. Pa ka ra, 10 times, 3 sets, while brushing teeth. 2. Hand exercises, 2 sets, while washing dishes or watching TV. 3. Brisk walk, 20 minutes after a meal. 4. Neck and scalp massage, 30 seconds each, morning and night. 5. One leg stand, 10 seconds, 3 times, while talking on the phone.
Small habits accumulate. The path to a younger brain is through consistency, not intensity.
Now, we ask you for one promise. Leave a comment below that says, Brain Protector. It's a commitment to yourself and a source of inspiration for others.
How old is your brain today? It's waiting for you to wake it up. Stay vibrant.